Hello and welcome to Infectious Information, a channel dedicated to infections, information, diseases, and other scourges of humanity. Today we'll be discussing a longtime friend of humans, syphilis. That's right, we're diving into the old junk rot, the reason powdered wigs exist. I'm going to ease you into this one with a little history. Firstly, we're not entirely sure where or when syphilis first popped up on the uglies of our ancestors, but the first well-recorded outbreak was in the 1490s in the Naples area of Italy, and the spread was attributed to an invasion by the French in 1494. It was believed by many historians that syphilis was most likely brought to Europe from the Americas and the Caribbean islands by Christopher Columbus and his crewmates after returning from their explorations. However, there is some contention, and it is now more widely accepted that the disease did in fact exist in Europe and Asia before the Columbian conquest, but in a different form, as treponematosis, a so-called parent disease of syphilis. Analysis of skeletal remains from Europe in the pre-Columbus era show evidence of treponematosis. It appears that treponematosis was a childhood disease, spread through saliva and bedding that would cause much less severe symptoms. The infection granted an amount of immunity to those who would later become infected as adults. However, when the hygiene of the day was improved and children stopped becoming infected, the disease would then, in adulthood, present as syphilis. Syphilis was prevalent from the 16th to the 19th century in Europe. However, there isn't much written record from the time due to the mode of transmission and the fact that the upper class were much more likely to suffer from the disease than the common man. It was a disease of repulsion and sin. So, to make record of the disease was considered taboo. And of course, being medieval Europe, the best treatment was mercury. And if you know anything about mercury poisoning, you know it was probably worse than doing nothing at all. In 1905, the organism that causes syphilis was identified by Fritz Schotten and Erich Hoffmann, and in 1909, the first effective treatment was developed using arsenical compounds, and it is considered the very first chemotherapy drug. In 1928, penicillin was discovered, and soon after, it was confirmed to be a safe and effective treatment for syphilis. So this brings us to the symptoms of syphilis. Well, believe it or not, it can be complex, as there are 4 stages of the disease: primary, secondary, latent, and tertiary. In its primary form, after direct sexual contact with an infectious lesion, a lesion of your own will form, usually within 2 to 6 weeks. Described on average, the lesion will be singular, firm, painless, and have sharp borders. Less than 40% of people infected will have multiple lesions, and it is more common in those with an HIV infection as well. Swollen lymph nodes around the area of infection is very common, and the lesion will persist for weeks without treatment. Without treatment, primary syphilis will progress to the secondary stage. This will occur 4 to 10 weeks after the initial infection. This stage begins with a rash in 1 or more areas of the body affected. This rash does not usually cause any itching and can appear on the palms of the hands and bottoms of the feet, and can even be so faint and unbothersome that it may go unnoticed. Secondary stage syphilis can also cause large gray lesions in the mouth, underarms, and groin area. It can cause fever, sore throat, hair loss, headaches, weight loss, swollen lymph nodes, and fatigue. Yet again, syphilis will pretend to go away even without treatment. However, without proper treatment, the disease will continue to progress to latent stage syphilis. This stage of the disease can last for years, with syphilis hiding within the body, showing no signs or symptoms, but slowly marching towards the tertiary stage. The tertiary stage of syphilis only occurs in a small subset of untreated syphilis victims, and it can show up 10 to 30 years after the initial infection, and it can be fatal. The disease in the tertiary stage will affect multiple bodily systems and organs. It affects the brain, nerves, eyes, liver, and bones. At any stage of the disease, the eyes, nervous system, ears, and vestibular systems can cause severe headaches, trouble moving, paralysis, numbness, and changes in consciousness, behaviors, and memory function, hearing loss, difficulty balancing, visual changes, eye pain, and redness. You can catch syphilis in 2 ways. The first is direct contact with a lesion or canker during intercourse. The second way to contract syphilis is congenital, or a pregnant mother spreads it to her child during pregnancy. Depending on how long the mother has had the disease, a high risk of stillbirth is possible, and even still, if the baby does make it to full term, they are at high risk of death soon after birth as well. Infant deaths resulting from untreated syphilis in pregnancy is around 40%. Even when babies of syphilitic mothers are born and show no signs of the disease, if the treatment is not immediate, they may develop seizures, developmental delays, and die. How is syphilis diagnosed and treated, you may ask? How can a disease that wreaks such havoc on the body possibly be neutralized? Well, syphilis can be diagnosed with a simple blood test. That's right, just go to your doctor and let them know you want the blood test to make sure your bad decision making won't kill you in 10 to 30 years. The treatment is also simple. Penicillin, the most basic of all antibiotics. There are alternatives to those fickle allergy sufferers, however. Penicillin is the most reliable treatment course. An important note from the CDC, antibiotic treatment will prevent disease progression, but it cannot undo damage done. So it's very important that you get checked regularly for these things, especially if you've had multiple partners, live in an area with high transmission, or are pregnant, and it couldn't hurt to get checked regularly for these things to begin with. So take care of yourself, stay vigilant, and go see a doctor, especially if it's been a while. Thank you for watching. Like and subscribe to hear more interesting information about all the ways your body can betray you.